challenge today to speak after Dr. Rajiv Jaydevan.
So we have Thomas Cherian. All of us know he's the president of the COC. Doesn't need an introduction. He'll be speaking to us on biosimilars, which are flooding the market now, and which biosimilar to choose.
All of us in retina practice and some of us in general ophthalmology practice nowadays use biosimilars. Intravitreal injections have been the mainstay of treatment in retinal diseases from the beginning of this millennium, and as time progressed, we had to cut down on the cost. Many biosimilars have been in the market for the last 10 years or so, and we have to choose between the various biosimilars available in the market. We have biologics and biosimilars. Biologics are a wide range of products such as vaccines, blood and blood components, and recombinant therapeutic proteins that prevent, treat, or cure a disease. Now we have the reference biologics and the biosimilars. Biosimilars are highly similar to the reference product with no clinically meaningful differences in terms of safety, purity, and potency. So what is a biosimilar? A biologic product compared with a reference product. These are highly similar to the reference product in purity, molecular structure, and bioactivity, and there are no clinically meaningful differences to the reference product, which are shown in pharmacokinetics, immunogenicity assessment, whereas additional clinical studies are needed as and when required. How do we select an anti-VEGF agent? Every disease, neovascular AMD, diabetic macular edema, retinal vein occlusion, all need sustained VEGF inhibition. After the safety and efficacy of an anti-VEGF are proven, we choose an approved drug which is time-tested and financially cost-effective to the patient. And when this cost-effectiveness comes in place, we need to have biosimilars. So what is important? The type of approved anti-VEGF agents, the number of injections to be administered, financial burden to the patient or to the government or to the supporting agency, whoever it is. Biologics impart a huge financial burden, whereas biosimilars are safe, effective, and more affordable and offer improved patient access. They are safe, effective, affordable, and accessible. Biosimilars are cost-effective options to improve patient access that could reduce the treatment burden by 25 to 50% when compared to the parent biologic drugs. Biosimilars and ophthalmology, the financial implications are there. The treatment cost is considered one of the most prominent factors for non-adherence in a patient who has been prescribed an anti-VEGF injection. And as many healthcare providers might move to biosimilars due to their safety, efficacy, and favorable cost-benefit ratio. About the cost of treatment, biosimilars reduce the cost of treatment by 25 to 50%. There are a lot of biosimilars now available for ranibizumab, and quite a few are in the pipeline for the next level molecules, the aflibercept. So why biosimilars? What are the challenges to anti-VEGF treatment in India? Because about 20% of the Indian population is below the poverty line, and India's per capita income is much less compared to the Western world. India is a developing country. Very few people have health insurance. Government supported programs are very less and limited to a few individuals, and approximately 70% of Indians pay for healthcare expenses out of their own pockets. Due to all these factors, many of our people, they drop out of the treatment because that is expensive from their own point of view. Biosimilar makes the medications affordable and help to reduce substantial cost burden. There's a global coalition of regulators voices confidence in biosimilars. The various biosimilars available in Indian market: Rasumab by Intas, Ranisural by Reliance, Visumab by Cipla, Raniase by Lupin, Osiva by Sun Pharma. All these are available in the Indian market. And Rasumab is one of the best biosimilars available today. It's the world's first biosimilar ranibizumab, and it has a therapeutic segment as an anti-neovascularization agent. This got DCGI approval long back. This was the first biosimilar to get a DCGI approval for wet AMD, DME, vein occlusions, and myopic CME. There is a head-to-head comparison of ranibizumab and Lucentis about the biosimilarity assessment. Rasumab is now used in all major government sectors, be it the CGHS scheme, the ESI scheme, or the ECHS schemes, because it has been approved by DCGI and it has stood the test of time. The clinical evidence suggests that ranibizumab biosimilar Rasumab has been equally effective to the innovator molecule. The safety and efficacy of the molecule has been proven in wet age-related macular degeneration. Efficacy has been proven by the ASSET study. The safety assessment also has been proven. The immunogenicity analysis similar with the innovator molecule. The ASSET study conclusion, Rasumab in patients with wet AMD over 6 months showed similar safety and efficacy profiles to the evidence supported with innovator ranibizumab. There is a large pooled safety study about the ocular and systemic adverse events. Again, it is comparable with the innovator molecule. The BALANCE trial shows a biosimilar versus innovator molecule of ranibizumab in neovascular age-related macular degeneration. It's a real-world evidence. The BALANCE trial, this is comparing with the innovator molecule in the central macular thickness as well as safety. In ROP, it has proven its efficacy and safety. Biosimilar appears to be an efficacious treatment in zone 1 and zone 2 posterior ROP, and the results are very similar to the innovator ranibizumab or Lucentis. No new safety concerns. It's safe in treating ROP, and given the advantages of its cost benefit as well as comparable efficacy, Rasumab may be safely used in managing ROP by retina physicians globally. The CSER study shows the efficacy and safety of Rasumab. This is an Indian study. Again, the CROWN study, this is an Indian study because the molecule came from India, and there are quite a few of Indian studies which have proven its safety and efficacy. In diabetic macular edema, again, it's the same, comparable with innovator molecule. Polypoidal choroidal vasculopathy, again the biosimilar has the same level of safety and efficacy as Lucentis. The REAR RD2 study, it's a long-term efficacy and safety of Rasumab in Indian patients with retinal diseases. This results from a prospective study, this is again from our own country. So real-life clinical effectiveness of Rasumab in retinal vein occlusion, REENACT study. Multicenter retrospective study, REENACT-2 on the use of Rasumab in wet age-related macular degeneration. The VRSI survey conducted between January 2018 and January 2020 again showed that many of our vitreoretinal practitioners in India are using the biosimilar with the level of confidence that they have with the innovator molecule. And which anti-VEGF to prescribe? Of course, our anti-VEGFs are all effective, but Rasumab is a good anti-VEGF to prescribe. And that is where we stand now. We have a good battery of anti-VEGFs available in India, and we have to choose from the anti-VEGFs, and all our molecules, especially Rasumab, Osiva, all these are good molecules with which we can safely treat retinal diseases in our practice today. Thank you very much.